So we'll be seeing preoperative patient and dental team considerations and instrument control. So whichever department you practice or whichever treatment you are giving to the patient, this is very important topic in respect to your clinical point of view. How you treat patient, what should be your position, patient's position, your assistant position, how to manage patient, all these things you will see in this topic. It's a very important topic considering your clinical point of view. We'll be seeing this topic under following heading. We'll be seeing introduction, positions, that is patient, what is patient position, chair position, operator position, assistant position, all these position during different procedures we'll see. Then we'll see about illumination, visibility, retraction, what are the instrument grasp, rest and fulcrum. All these things are very important while performing any clinical procedure in dentistry. Moving on to the introduction, the practice of dentistry is very demanding and stressful. So while you perform different procedures, you have to give many things while doing the patient. It is very demanding and at the same time it is stressful to your body. So there are many physical problems which may arise if appropriate positions are neglected. Like backache, many neck pain, there are many problems and number of problems that may arise due to your inappropriate position. Most restorative dental procedures can be done while seated. Uh, Compared to the other department, most of the procedures done in the restorative department or endodontics department are done while you are sitting. So most of the restorative dental procedures can be done while seated. In any clinical procedure, it is necessary and important to ensure that the patient and operator position is properly selected. You perform any procedure, the patient's position is also important and your own position is very important. Assistant position is also important. Assistants will help you, will assist you to give instrument, different types of instrument you require in between procedures. So assistant position is also very important. We'll see handpiece position, instruments, illumination, all these things are very important. We'll see one by one. Moving on to the positions, efficient patient and operator position is beneficial for welfare of both. The position of the patient and the operator both are very important, and it is beneficial for both. The patient should not be in any uncomfortable position while he is on the chair. The patient is, if it is a more comfortable position, he is more relaxed, has less muscular tension, more capable of cooperating with the dentist. So your patient should be at utmost comfortable position, so he will be more relaxed and he will cooperate properly during the treatment. Suppose patient is uncomfortable and at the same time you are performing a root canal treatment on the patient. Already patient is stressful due to the tension or the anxiety, and at the same time his position is also not relaxed. So patient cooperation will reduce. So at least you can give him a comfortable position on the chair. At the same time you should be comfortable to perform any dental procedure. By using proper operating positions and good posture, the operator experiences less physical strain and fatigue, reduces possibilities of musculoskeletal disorders, and avoid unnecessary curvature of the spine or a slumping of shoulder. So, uh, many most of the dentists after practicing suppose 5, 10 years or 20 years, they undergo musculoskeletal disorders. This is the most common problem in the dentistry. So if you are using proper position and a good posture, then the chances of these problems occurring in your future lives are less, and your working time or a duration of your active life will increase definitely. So if you want to practice for a long term practice, if you're thinking of long term practice, you have to follow your operatory position properly since from the beginning. Do not use any uncomfortable or awkward position. Whichever procedure you are performing, your position should be comfortable. Do not use any uncomfortable position or awkward position. Proper balance and weight distribution on both the feet is essential when practicing standing dentistry. Most of the practitioners perform many procedures while standing, like extraction or many procedures they perform standing. Your weight should be balanced, and your weight distribution should be on both the feet equally. Objectives, access to the main objective of Proper positioning is access to the operative field, visibility, comfort, and patient safety. So these are the objectives of the proper chair position, proper patient position, proper operator position. What are the objectives? Access to the operative field, proper access to the operative field. Suppose you are performing a root canal treatment on your lower second molar. So access to that field, access to the second molar is very important. Visibility of the area is very important. According to your access and visibility, you have to position your patient, yourself, so that you get proper access, visibility. At the same time, you get comfort and patient safety. Coming on to the chair and patient's position. Uh, Again, this is very important consideration for both patient and operator. Modern dental chairs are designed to provide total body support. Compared to previous chair, old chair, you can see many advanced chair coming up, and they are giving proper body support to the patient. Chair design and adjustment permit operators maximum access to the working area. Adjust headrest cushion. So headrest adjustment for the patient is very important to support the head and elevate the chin slightly away from the chest. It will give minimal neck muscle strength. Your head should be properly rested on the headrest of the chair and elevate chin slightly away from the chest. Your chin should be slightly elevated so that there is minimal neck muscle strength.
Udah tuh nah.
The next is the most common patient position for the operative dentistry. These are the two most commonly used position for operative or endodontic procedures. Almost supine, this one is almost supine, and this one is reclined at a 45-degree angulation. These two positions are commonly used while performing restorative dentistry. Both are recommended for the sit down dentistry. In both these positions, the operator is in the sitting down position. Use depends on arch being operated upon. So use of either of these positions depend upon which arch you are performing procedure. The choice of the patient position varies. Operator type of procedure and area of the mouth involved. Choice of the patient position depends upon the operator. What if you are left-handed, right-handed operator's choice, type of procedure you are performing, and the which area of mouth is involved. The patient is positioned in a semi-supine or supine position so that the operative field is over the operator's lap at the height of operator's elbow. So whichever position you are using, your operative field should be at the level of your operator's elbow. Suppose you are performing your root canal treatment on upper molar, the upper molar should be at the level of your elbow, right? The patient may aid the operator by slight head rotation towards or away from the operator. So you can ask patient to slightly rotate his or her head towards or away from the operator depending upon the site of operation. This supine position enables the operator's forearm to be parallel to the floor when working in the operative field. So operator's forearm should be parallel to the floor. This is also very important. So which are the important points? Operative field should be at the level of your elbow and the operator's forearm should be parallel to the your floor. In the almost supine position, the patient head, knees and feet are approximately at the same level. Here you can see in almost supine position, the patient head, knees and feet are at the same level. Patient head, knee and his legs are at the same level in almost supine position. Patient's head should not be lower than the feet. Patient head should never be lower than the patient's feet. The patient should be at the level or above the level of the feet. Should not be lower than the level of his feet. Only in case of syncope, the head should be positioned lower than the feet only in the emergency as when the patient is in syncope. When you will lower down patient head in case of emergency, medical emergency like a syncope, where we supposed to keep patient's head below the level of his leg. All of the procedure, patient's head should not be lower than the feet. When the operation is completed, the chair should be placed in the upright position so that patient can leave the chair easily and gracefully. preventing undue strain or loss of balance. So after completing the procedure, the patient, the chair should be upright position, in the upright position, and then patient should leave the chair. You are not supposed to ask patient directly get up from the supine position. Make the chair upright and then ask patient to leave the chair. Coming on to the operating positions. Operating positions may be described by the location of operators or by the location of operator's arm in relation to the patient position. Depend upon the operator and the chair or patient position. For a right-handed operator, there are essentially three positions. So these are the three commonly used positions in the dentistry. This is called as right front, right and the right rear. These three positions are commonly used, that is right front position, right position and right rear position. These are also referred as 7 o'clock, 9 o'clock and 11 o'clock position respectively. So you can see in the diagram, so here this is this is the patient sitting on the chair. This is 7 o'clock, like a clock. We have given the names. This is a right front position. Patient operator can sit here and perform the procedure. A right position or a 9 o'clock position, operator can sit here and work. And a right rear or a 11 o'clock position. The operator is sitting here while performing the procedures. There is another position called as direct rear or a 12 o'clock position. So these are the important position, different positions performing 7 o'clock or right front, 9 o'clock or a right, 11 o'clock right rear and direct rear or a 12 o'clock position. The usual chair position for the maxillary arch should not be used when adjusting the casting or a crown. So usually we use a supine position while performing treatment on the maxillary arch. But this supine position should not be used when you are trying different castings or a crown. Suppose you are placing crown, so you should not use a supine position. The patient should be positioned in a more upright position with the patient's head directed to the left or right, so that if the casting should drop, it will drop into the buccal vestibule. Understood? If you are trying a crown on the patient's mouth in the maxillary arch, there are chances that the crown may fall in the throat. So you are asked patient or make patient to sit upright in the upright position, and the patient's head should be directed towards left or a right. If by chance a casting will drop or it is not fitting properly, it may fall in the buccal vestibule and not directly into the throat. So while checking the casting or different crowns, you are supposed to make sit patient in the upright position. Moving on to the left-handed operators. The most of us are right-handed, but for the left-handed operator, there are three positions: left front, left, and the left rear. uh, Also called as 5 o'clock, 3 o'clock, 3 o'clock and 1 o'clock position respectively, same as the right hand operator. Fourth position, a direct rear or 12 o'clock position, has applications for certain areas of the mouth. In some cases, you need a 12 o'clock position or a fourth or a direct rear position directly behind the patient's head. As a rule, the teeth being treated should be at the same level as the operator's elbow. This is a very important rule. In any position, the operator's elbow should be at the level of your teeth to be treated. It is important to recognize that there are four major zones of activity around the operative field. We are performing on a patient. There are four zones or four different operative field zones of activity around the operative field. These are the four different zones: the operator zones, the transfer zone, the assistant zone, and the static zone. So all these zones are very important. The operator zone is where we sit and practice. The transfer zone is where your assistant is transferring different instrument, different material to you. The assistant zone is where the assistant is sitting. In the static zone, there is no movement in the static zone. Coming on to the different position, here you can see different positions. Just a moment. So 11 o'clock position, considered the most universal operating position. So most of the procedures performed in the restorative dentistry are performed at the 11 o'clock position. It provides access to all areas. If you are sitting at the 11 o'clock position, you will get access to all areas of the mouth except more distal areas of the mandibular right quadrant. So if you are sitting here, the distal area of mandibular right quadrant and the cervical area on the patient's right posterior quadrant. So these areas, right quadrant, posterior region, are only unaccessible by this position. All the rest of all areas are accessible by 11 o'clock position. So mandibular posterior and maxillary posterior areas are inaccessible in 11 o'clock position. The next is 9 o'clock position and the 7 o'clock position, an alternate position for the mandibular right posterior quadrant. So all other procedures are at 11 o'clock position. For mandibular right posterior teeth, you are supposed to use 9 o'clock or 7 o'clock position, usually used in conjunction with the mouth mirror. 7 o'clock position, so this is 7 o'clock position, a right front position is used for mandibular anterior teeth, mandibular posterior teeth, especially on the right side, and the maxillary anterior teeth. So you are sitting here, you can do work on the mandibular and maxillary anterior teeth and right mandibular posterior teeth. So this right front position used for mandibular anterior, maxillary anterior, and mandibular posterior teeth. Once you start doing patient, you will understand all these things. Next is 9 o'clock, convenient for operating on the facial surface of the maxillary and mandibular right posterior teeth and the occlusal surface of the mandibular right posterior teeth. 12 o'clock position is utilized for maxillary and mandibular anterior segment. So when you are doing your mandibular anterior teeth, you are sitting on the right rear position. A common fault in operating at this position is to use direct vision, resulting in the severe bending of the operator's back and the neck. So when you are sitting in the 12 o'clock position, most of the time operator will uh, use direct vision, and that will result in the bending of the operator, giving you a severe neck and back pain. So these are the position of your hand while sitting in the different position. Suppose you are sitting in the right front position, you can do it on the occlusal surface of the mandibular right posterior teeth in the mouth mirror. So you are sitting in the front or a right front position or a 7 o'clock position. This is your 9 o'clock position or a right position. Here you can see a mouth mirror is used to retract, and you can work on the occlusal surface of your right mandibular posterior teeth. For your maxillary posterior teeth, you can use 11 o'clock or a right rear position. You can see here, operator is sitting at the back of the patient at the 11 o'clock position, and he is performing while seeing in the mouth mirror. This is 11 o'clock position, and this is direct rear position or a 12 o'clock position. Suppose you have to perform on the lingual aspect of your mandibular anterior teeth or the lingual aspect of your maxillary anterior teeth, you can sit in the direct rear or 12 o'clock position and perform procedures on the mandibular anterior teeth. So these are the different hand position according to your sitting position. Coming on to the transfer zone, it is located near the oral cavity where instruments and the material are transferred between the operator and the assistant. So these from this zone only, operator will give you material and instrument and take it from you. The assistant zone allows the assistant to access the both the transfer zone and the static zone. The assistant working from the 3 o'clock position does not change position related to the patient as does the operator. So assistant zone is very important. He is sitting at the 3 o'clock position. He does not change position related to the patient. His position is fixed at the 3 o'clock position. He does not change his position according to the patient and according to the as does the operator. The static zone is having no traffic flow, contains auxiliary equipment and the supplies for the operating team. So the static zone contains different auxiliary instrument and different material which will require during the procedure. So coming on to the different zones, this is for the right-handed operator. So here patient is sitting here. This is 3 o'clock or assistant position. This is called as assistant zone. The next is transfer zone. This is the transfer zone. From here patient will transfer, assistant will transfer different instrument to the operator. This is the operator's zone. Operator can sit in the 11 o'clock position, can sit in the 9 o'clock position, can sit in a 7 o'clock position. So this is the operator's zone, and this is the static zone where no movements occur. So from 12 o'clock to 7 o'clock, operator zone. From 7 o'clock to 4 o'clock, this is transfer zone. From 4 o'clock to 2 o'clock, that is 3 o'clock, this is assistant zone, and this is the static zone. Same as that for the left-handed operator. Left-handed operator zone, transfer zone, assistant zone, and the static zone. A desirable posture position for the operator is one in which the operator seated well back on the stool with the feet flat on the floor, legs relaxed and relatively together and thighs parallel to the floor. This is very important. Every word in this para is very important. A desirable posture position for the operator is one in which the operator is seated well back on the stool. The operator is properly seated at the end of the stool, well back on the stool, with his feet flat on the floor. His feet, both the feet should be flat on the floor. Legs should be relaxed in the position relatively together and the thighs parallel to the floor. His thighs should be parallel to his floor. So his back straight, sitting properly, legs relaxed, uh, and the feet on the flat on the floor, and his thighs parallel to the floor. This is the proper position of the operator, and this is, you can see here, in correct position. The operator is bending, his legs and thighs are not properly placed. The back is straight and the supported by the backrest. Back should be properly supported for the with the backrest. In incorrect and often seen fully bent neck, hunched shoulder, and raised elbow. Your position should never be like this. You should be relaxed straight back position. It's very important while performing the procedure. The face and the operator should not come in close proximity. The face of the operator should not come in the close proximity of the patient. Very important. Your face should not come in very close proximity of the patient. The ideal distance is similar to the like reading a book. It has to be maintained different between your patient and your face, operator face and patient face. Maintaining an appropriate working distance from the patient is very important for the operator to master in the early stage of learning. When you start doing patient in the early stage only, you have to keep this habit of maintaining an appropriate working distance between you and your patient. Another important aspect of proper operating position is to minimize body contact with the patient. You should minimize your contact with the body contact with the patient. All the contact should be restricted to only in the oral cavity. Other contact should be minimized. The proper operator does not rest his forearm on the patient's shoulder or hands on the patient face or forehead. You should not get your support or any rest from your patient's shoulder, hands, patient face, forehead. The patient chest should not be used as an instrument tray. Unnecessary contact in unpleasant is unpleasant to many patients and should not be practiced. Many a time while performing different positions, the operator will use patient chest as an instrument tray. It should be strictly avoided, as this unnecessary contact is unpleasant to many patients. Here you can see recommended sitting position for operator and chairside assistant with the height of the operating field approximately at the elbow level of the operator. Here you can see the operator is performing on this, the operator, the height of the elbow and the operating fields are at the same level. The operator is sitting at 11 o'clock position with the straight back. At the 3 o'clock position, assistant is sitting maintaining a proper distance from the operator. We'll see instrument actions and the other things in the next class. We have seen the different chair positions, operator position, assistant position. We'll be seeing instrument exchange, illumination, visibility, and other things. Lighting, how should be the lighting in the operating field. All these things in the next class. This is very important lecture considering your clinical point of view. Read it from the student. While coming to the next class, you will understand more clearly. Just a minute. I have to take the attendance. Just be here.